of Health and Community Education at Piedmont Healthcare, and adjunct associate professor of medicine at the Morehouse School of Medicine. Dr. Morgan, thank you so much for joining us.
It's a pleasure, Kelly. Thank you.
Well, always a pleasure to have you. So this, as you know, is a groundbreaking test. Where do you believe the science goes from here?
When we look at these studies, one thing we always want to look at is whether or not there is causation. In other words, where there's smoke, is there fire? And we absolutely have begun to link social isolation, depression with dementia. And as we look at what is the process of aging and how can we have a population that is aging in a more in a healthy fashion, in a more dignified fashion, these are all things that we are looking at because people want to maintain validity, they want to maintain their independence and also their ability to socialize. So these are all very, very important factors. Alcohol is an incredible link because heavy drinkers and binge drinkers have an increased risk of dementia over those who are moderate drinkers or teetotalers, meaning they don't drink at all.
Wow. So my next question being, are there ways people can get a head start on reducing their risk of dementia? You may have answered part of the question just with that last statement.
Absolutely. Don't smoke. Maintain a good blood pressure, maintain a good control of your diabetes if you have it, but also if you have depression, make certain that you are treated. Make certain that you are involved in activities where you are socializing and you have good human connection and contact. We are beginning to understand how important that is, especially coming out of COVID, that human contact as Homo sapiens, as human beings, and how important that is to our health. When we look at sleep as well as we get older, there is something called phase advancement of sleep. And so earlier to bed, earlier to rise, these are all factors that we are looking at as we begin to try to understand what is the connection of depression and alcoholism and dementia.
Fascinating. Speaking of COVID, we've all had that cough or runny nose that just won't go away, even after an illness is gone. Shaking that can be tough, but why does it happen? So COVID, flu, and RSV cases, they're hitting the states nationwide, skyrocketing hospital cases. 200% of hospitalizations are flu-related now, while another 40% are due to COVID. So a lot of times these symptoms, doctors, for both can be very similar. How would you advise patients distinguish between the common cold and COVID, and when did they check into a hospital?
And so we've got this confluence of viruses. This is our second season with having 3 viruses. And you're right, the symptoms are very similar. Don't forget, however, if you are feeling poorly, having difficulty breathing, having difficulty catching your breath, regardless of what type of infection you have, you should always seek medical care. Something else to think about with prolonged illness, it may not be the same virus. You may be getting successive infections. In other words, you're infected with one thing, and before you could recover, you're infected with another virus, and you think it's the same thing because the symptoms are very similar. As we continue to come out of COVID, where we've been masking, where we've been in social isolation, we haven't had these exposures. And the other thing that we have to think about is that our vaccination rate with these updated vaccines is very low, less than 25%. And vaccines protect you from severe illness and also from contracting these viruses. And so we want to think about what all of these things are in our environment and why we may be having prolonged symptoms. It may not be one thing, it may be a couple of things.